It's moments like this that Julie and Michael McMullen of Sewickley don't take for granted.
Throw it out here. See who can
In
hit it further.
2006,
You or Chloe?
Julie was the mother to then 6-year-old Chloe and engaged to be married when she was diagnosed with ovarian cancer. The discovery came after multiple trips to the emergency room.
There were 3 or 4 times that I had gone to the emergency room just with abdominal cramping, stuff like that, that I like to think that I have a pretty high tolerance for pain.
She does.
But it was, it was terrible. So we would go and they'd just send me home with some, something to take care of the pain. Hey, you.
But the last time was different.
I was on the phone with the nurse, and my wife was actually in the closet, screaming in pain.
Again, the couple rushed to a hospital where Julie was treated by the on-duty gynecologist.
They did the ultrasound and realized that it had burst, and I had fluid all the way up, even under my lungs and under my rib cage. He said, you know what, let me go in, take a look, because this really isn't normal.
When Julie woke up, she got the news.
They told me that, I had ovarian cancer, and it was a total shock.
Well, it was, I mean,
It's okay, I'm okay.
I mean, I remember this, like it was yesterday. It was amazing. So I'm sitting in there, and we're newly engaged, and my fiance has cancer. Ovarian cancer.
At age 27, Julie was in the minority. 90% of women who get ovarian cancer are older than 40. Despite that startling diagnosis, Dr. Thomas Krivak, who was asked to consult on the case, made a surprising statement.
So Dr. Krivak's like, you don't understand. He goes, this is the luckiest day of your life. And I'm like, well, who is this guy?
Alrighty, well, I'm very pleased with all these test results.
Dr. Krivak was encouraged because Julie's cancer was caught early. Dr. Krivak is a gynecologic oncologist with the Allegheny Health Network. And when it comes to cancer, a GYN oncologist has more training than an OB/GYN.
What sets us apart is that it's a 3 to 4 year training, intense training in cancer. So instead of seeing a patient that may have a gynecologic malignancy once a month, once every other month, this is something that I see on a daily basis.
While ovarian cancer is rare, it is the deadliest cancer of the female reproductive system. There are 4 stages. In stage 1, the cancer is confined to the ovaries. Stage 2, it is spread to other locations in the pelvis. Stage 3 means it has gone into the abdomen. And stage 4, the cancer has spread to organs beyond the abdomen, like the liver, lungs, or spleen. Before Julie's surgery, Dr. Krivak discussed fertility options.
Any lumps or bumps or anything like that?
He gave us all different scenarios. One was I could come out and have nothing, a full hysterectomy. I could come out and, maybe he can keep one ovary. There were so many different things. Where's the digger?
Both Julie and Michael wanted more children, but not if it meant risking her health.
I said, if this was your wife, this was your daughter, what would you do? And whatever the answer is, that's what my answer is.
All kinds of stuff that
Julie's
makes noise.
cancer was stage 1.
When we did with her surgery, it was conservative, so we left the uterus and other ovary in. All her lymph nodes were negative that were removed. It was a very thorough surgical staging.
Which meant Julie could have more children.
I was thrilled. We definitely wanted to have another one. So it was almost, it was a relief too that, okay, we can still, do this and it'll be okay.
But before thinking of kids, Julie's body had to prove that it was ready.
The greatest risk of recurrence for patients with ovarian cancer is generally within the first 2 to 3 years. So what we had talked about with Julie and Mike is making sure that we get her in remission.
That means normal results for all exams, imaging, and CA-125 tests. The CA-125 test measures the amount of a protein called cancer antigen 125 in your blood. The protein can be found on ovarian cancer cells. Still, the CA-125 test is not definitive.
people with appendicitis, people with liver disease, lupus, this can falsely elevate the CA-125. The ultrasounds look good. I know that we talked about
The protein can also be found on healthy tissue, and many women with early-stage ovarian cancer have normal CA-125 levels.
Screening test for breast cancer is the mammogram. Screening test for colon cancer is the colonoscopy. Unfortunately, we do not have a screening test as of yet for ovarian cancer.
Symptoms for ovarian cancer include abdominal bloating, pelvic discomfort, a change in bladder or bowel habits, nausea, and vomiting. But by the time some women experience symptoms, it usually means the cancer has spread.
Unfortunately, ovarian cancer is a very silent cancer until it gets to the advanced stages. So the majority of patients we see that come referred into us will have cancer that is metastasized.
56-year-old Elaine Becker of Carrick was one of those women. After experiencing classic symptoms, she was diagnosed with advanced ovarian cancer in 2001. The disease ran in her family, and she knew how devastating it could be.
I had watched my mother die of ovarian cancer when I was 19. She survived 6 months from date of diagnosis to when she died. And I fully expected the same thing would happen to me.
Elaine went to see Dr. Frederick Price, another gynecologic oncologist with the Allegheny Health Network. He performed an aggressive operation.
We treat each patient as if their disease is going to be one of the successes. So we do the aggressive treatment, we do the aggressive chemotherapy, and then we watch closely the survivors. And we watch for signs of recurrent disease. And then we go into an aggressive mode again if that's warranted in the future.
The aggressive surgery is called debulking, which is removing all visible signs of cancer.
One thing about ovarian cancer is that if you don't have a specialist who's geared towards the concept of complete debulking, do your primary operation. You will suffer. If you have a general surgeon who's not accustomed to thinking about metastatic disease as a potentially curable situation, they'll open the abdomen, they'll say, disease is spread, I can't do anything. Close the abdomen, go out and tell the family the tragic news that the disease is too far gone to do anything. Whereas the gynecologic oncologist, with a couple of screws loose up at top, we'll spend the 6-8 hours looking for disease behind things, looking for it under things, trying to remove things, reconstructing things. And that's the difference, and it makes a huge difference in survival.
Dr. Price says recent advancements in chemotherapy have also made a big difference in survival rates.
The therapies have become less toxic, more tolerable, and much more effective. There are ways of treating the disease by giving chemotherapy directly into the abdominal cavity, which gives places where the cancer is most likely to recur, gives those areas a bigger dose of chemotherapy, and can prevent the disease from coming back for longer periods of time.
For Julie McMullen, losing her hair during chemo made having cancer feel real.
Because you'd have to look every day in the mirror and see it. Every morning when I would go in and look in the mirror, I'd be like, ugh, it's still gone. It hasn't come back yet. And I know it sounds vain because you know it's your hair, but it's a big thing to lose all your hair.
Especially when it affects one of the happiest days of your life.
Well, I got married with a wig on, which really wasn't in my plan, but it was what it was, and I really didn't have any other choice.
I thought you looked beautiful in it.
Yeah.
Since there's no screening for ovarian cancer, the only way to know for certain if a woman has it is surgery. But if the disease runs in your family, you can get tested for the BRCA1 and BRCA2 genetic alterations, which are also used to predict a woman's chance of getting breast cancer.
And the test used to be a blood test, and they would extract the DNA from the white blood cells. Now it's a test where you take a small bottle of mouthwash, you swish in your mouth and you spit into a cup.
Fewer than 2% of women will develop ovarian cancer in their lives. But among women with the BRCA1 gene mutation, nearly 40% will get ovarian cancer. And up to 17% of women with the BRCA2 alteration will have the same outcome.
In my generation, pretty much everyone has been tested that I'm in contact with.
Because of Elaine's family history, her niece, Emily Liska, who's now 32, was tested several years ago and learned she has the gene mutation.
When I was given my original diagnosis of the genetic variant, there was a doctor in the room that told me that within the next 18 months I had to have both of my breasts removed. And I'm in the middle of my 20s being told I'm going to have to start cutting different pieces off. That was a shock.
Uncomfortable with that advice, Emily went to see Dr. Price, and together they chose to keep watch for now.
Lined myself up with people that I felt very comfortable with, that were very knowledgeable, and helped set me on a schedule of surveillance, and that's where I finally started to feel more comfortable with moving forward.
Moving forward for Emily meant starting a family. She and her husband Greg decided to adopt. Knowing she would not be passing the BRCA gene mutation to her daughter Rachel played a role in that decision.
I had had a lot of really wonderful experiences with adoption growing up. So getting the genetic diagnosis before I had kids really brought the adoption from the background into more of the foreground. So I won't say it was the only factor, but it was a factor in deciding to pursue adoption.
As for the McMullins, after surgery, follow-up visits, and chemotherapy, it was nearly 2 years before Julie and Michael got the go-ahead to try to have more children. And after having Richie, who's now 2 years old, they've become a very grateful family of 4. At a recent appointment, Dr. Krivak delivered some long-awaited good news.
As far as I'm concerned, you're cancer-free. Took them 6 years to say it.
When they decide they're finished having children, Julie will likely have a full hysterectomy as a precaution. Being proactive is something Elaine is grateful her niece Emily has the opportunity to do.
I think she's courageous. I think she's intelligent. I compare this to my mother's generation, and think about how little they did know at that time. And so they were walking in the dark.
But with recent advancements, these women and their doctors want people to know there's hope.
I hope that my story becomes the norm and not the exception.
We are making improvements in quality of life for patients with ovarian cancer. They are living longer.
I'm very optimistic that ovarian cancer is going to continue to have tremendous improvement in survival and outcome.
One group to thank is the women who came before these survivors.
I think about all the people that suffered and went through trials and surgeries to allow us to be where we are today, and what they've done for us. That's why I'm still sitting here, because my mother and her sister went through this. And what they did and what they endured allowed me to recover. I owe them a great debt.